Medical professionals around the world stay busy with patients infected with COVID-19. One of those doctors is Christopher Voscopoulos, ICU director at Southern Hills Hospital.
The virus is currently transmitted primarily via respiratory droplets.
What that means is
an individual who is positive for COVID-19 might, say, sneeze or cough, and what they do is they inject out into the air viral particles.
You can catch the virus if those particles that linger in the air up to 3 hours enter your nose or mouth. Dr. Dahlia Wax, a board-certified family physician, demonstrates just how much contact we make with our face without even realizing it.
Touch the computer again, fix our hair. Sometimes we'll maybe fix our teeth. We might eat something, drink something, glasses, put our glasses on.
Something doctors want to make clear.
The virus is not getting into the human body by just skin contact.
For example, if the item I just bought at the store is contaminated, I can't get COVID-19 just by touching it. I can, however, get infected if I touch my face before washing my hands for 20 seconds. Gloves can also be key in stopping the spread if you use them right.
When they remove the glove is to take the distal-most aspect of the glove here and then to peel it off, turning it inside out. So again, the concept is that the viral particles are on the outside of the glove.
Masks can also provide a barrier in two ways, from the virus transmitting from a person with coronavirus or for a person trying not to breathe it in.
Using the elastic, either to remove it on one side and then come over to the other like this.
Take it off like this. If you take it off like this, you basically just, again, touch your nose, touch your mouth.
And those masks can be reused if taken off properly and even washed. Reporting in Las Vegas, I'm Tiffany Lane with News 3.